and I'll get this out to you. But it sells for 20 schmackaroonies on the site, the main website, emsseo.com. Go find out for yourself. But I'm giving it away free just for the month of November. So do me a favor. Interested in this? 116 pages, lighten that textbook load. Go check it out. So today, like I said, I want to talk a little about ACE inhibitors. You know, that's one of those things where we see a lot of patients on them, right? You know, lisinopril is one, captopril, another one, ramipril is one. You might have seen these drugs, or you see it and your partner or someone might say, oh, they're on an ACE inhibitor. Okay. The thing is that when patients are on these drugs, and this is rare, but there are some side effects that you really should know as an EMS professional, because these side effects can lead the patient to death. And if you look out for them, you'll know them, you know what to look for. So one of the big things is that angioedema, and you think about that and you think about anaphylaxis and stuff like that, right? But when it comes to an angioedema and an ACE inhibitor issue, that is a totally different thing that could be going on for your patient. And this is why it's very important to understand, because the treatment itself is a little different. So when listen, I know, like I said earlier, this is something a lot of people don't know. You don't necessarily learn this in EMT or paramedic school. And, you know, we know, again, the angioedema you get when somebody's having, allergic reaction of something, the oxygen, the IV, the cardiac monitor, Benadryl, epinephrine, even Salumedrol, whatever. That's our basic treatment for that, right? But when you're talking about an angioedema due to the ACE inhibitor, the angioedema is not really responsive to the common treatments that we might do. So you might start going on the path thinking that there's some kind of allergic reaction going on, but it's really a reaction to the ACE inhibitor that the patient is having, right? The side effect that the patient's having for that. Okay, so it's not really reactive to that. All right, so what you need to do and what you need to think about is other treatment models, and basically they're kind of the same, right? You're still giving oxygen. You're still, maybe even having to ventilate the patient with a BVM. You might move on to an RSI type thing if you're a paramedic, but fluids, IV fluids, or Salumedrol and epinephrine. But your epinephrine for this patient might be more the racemic epi drips, IM epi, things like that, because of the alpha-1 receptor, properties that epi has, right? That vasoconstriction. So just something I want you to keep in mind. I know this is kind of not the most exciting video today talking about this stuff, but the reason why I bring it up, guys, something like this, is because, as EMS professionals, we get so locked into the common things that we see. We see the angioedema, we start thinking other things that are going on, right? The anaphylaxis and stuff like that. And we don't take a second to think that maybe something else is causing this. Okay. So this is something that I think we need to really kind of think about, because again, when you know some of the side effects from an ACE inhibitor like this, it can help you if you start seeing an angioedema. Maybe think to yourself, hey, just think about it for a second and start thinking, hey, maybe this angioedema is due to the ACE inhibitor that they are taking, and that's why they have it. That's a side effect. Because again, being able to recognize it, guys, these patients can end up dying on you. And if you're treating it the regular way with Benadryl and things like that, it's not going to work, and you're going to be scratching your head why. So being a good EMS professional that you are, because you're watching this video, you will understand that there's more to it than just what you might have seen and the bulk of what we're trained on. But again, the ACE inhibitor side effects and patients that this happens to, I think it's like 1%. So it's not a big percentage of people that this happens to, but keep it in the back of your mind, right? I'm hoping these videos are going to do for you. Just keep little things like this in the back of your mind when you are taking care of patients. And then hopefully, if you ever have a patient like this and they're on an ACE inhibitor, like again, you will be able to, little bell go off, and you'll consider that that's the cause of that angioedema. That's one of the side effects that they're having from the ACE inhibitor that they are on. All right. So that's it, guys. SM, I see you over in the YouTubes. You say need help studying tips. If you do, be sure, if you need study tips, go to emsseo.com. Lots of videos there. And my YouTube page, of course, I have lots of tips on study and exam prep as well. And don't forget, go to freeemsbook.com. Get yourself a free copy of my EMS quick study guide. Let me back up. My light is really making this all shingad here. But EMS quick study guide. Go grab yourself a free copy before they run out. I'm only doing this till the end of November. So go grab yourself a copy. All right, that's it, guys, for me. As always, Jim Hoffman from emsseo.com. Go to freeemsbook.com. Get yourself that free book. All right, that's it, guys. As always, stay safe.